Thanks, Brittany.
Thank you, Brittany. Okay.
Hopefully it's just coming through for you. Now, slideshow view. Hopefully you can all see that.
We're in business.
Perfect. Thank you.
Fab. Over to you, ladies.
Hopefully everybody can hear me okay. So good morning all. We are Liz and Patsy, and we're extremely pleased that you've joined the call today to hear more about AHP professions. We'd love to know more about you. And if there's any specific AHP profession that you're interested in, please put that in the chat, so that help us know where we focus more on. We hope the session's a bit interactive, and also as we've said, we want you to ask questions in the chat or put your team's hand up at any point, and we'll see if we can answer anything. So Liz and I are both AHPs. Liz is a physiotherapist and I'm an occupational therapist, and I know some of you have already had a session on both of those professions, and we will touch on them a little bit today, but not in great detail, but glad that you've had that. So we won't be able to cover everything about all of the professions, but you will get an overview, and we can signpost you to key links and resources, and you'll have that in the slide set after. Next slide, please, Brittany. So we're going to ask you a few questions just to get us started, and you can either give us a thumbs up or a thumbs down to the question, or a comment in the chat, please. So I think I know the answer to this, knowing what some of you already had. Have you heard of allied health professions? I guess would be a starter question. Good.
Yeah, that's one.
Thumbs coming through. Anybody else? Thumbs up, thumbs down.
Excellent. We've got a no.
Okay, good. Okay, so we have got some no's, we've got some yeses. Okay, well, hopefully by the end of the presentation, those of you that don't, you will know exactly who we all are, and those of you, yes, hopefully have a little more detail. Okay, let's go to the next question. So how many professions are there in the allied health professions group? Have you got any idea? If not, I will give you a benchmark. So it is, someone said 15. Oh. Okay. That's interesting. Any other offers? I'll give you a clue. It is less than 20. Okay, so we've got a 10, we've got 15, we've got an 11, we've got 13. Everybody's getting very close. 12, 11. You are all extremely close. Have we got another offer? It's in the middle of there somewhere. 16. Lower. Okay, we've got a 14. We've got two 14s. Absolutely. We have 14 allied health professions. So, but well done. You're all in a really good ballpark position. So quite a lot of us that are in that group, but each profession is a profession in its own right and registered in its own right, but we are grouped under the title of allied health professions, just to explain it, because that can be a bit confusing sometimes. So just to explain that, and often that gets shortened to AHPs. Okay, next question, Britt. Oh, it's a bit contentious. Are we as important as doctors and nurses? Liz and I know what we think. It's a bit of a tricky question, really. Any yeses, any nos?
Excellent.
We've got a yes. We've got a yes. We've got a yes.
Yeses. Well done.
Excellent.
We think so.
Okay, so it's a naughty question on our part, really. I think what we're trying to say is, very often you'll hear lots about doctors and nurses on programs in the news, in terms of professional groups, etc. But yes, Liz and I would definitely say AHPs are as important, and I think it's about the contribution in terms of patients, and every profession is unique and offers something equally important to patients. So absolutely. And we are the third biggest group in terms of professions in the NHS. So we are absolutely as important as doctors and nurses. Next question. I think this is our last one. Have any of you had treatment from an AHP? Do you know if you have? Got some no's. Look, lots of no's. Okay.
The majority seem to be a no.
Okay. So sometimes you might not even know that you have had. If any of you have had surgery and gone into theatre, you might well have had some intervention from an ODP, operating department practitioner who's an AHP. If you've ever had an X-ray, you may well have come across a radiographer. So sometimes you might not always be aware that they are AHP professions. So okay, so again, it's a tricky question because you might not actually know, but okay, thank you. That's our question, just to get everybody into the presentation. Next slide, please, Brittany. I need to move myself on. Hang on a minute. Just bear with me. Okay, so this slide just shows you the 14 allied health professions, and it is a little bit hard to read in the presentation, but once you get the slides, you'll be able to see them more clearly, and as we go through, you'll hear about the 14. So those of you that are good at maths, you might have spotted that there are actually 15 on this slide, which did flummox me actually when I looked at it first of all, thinking, hang on, we've got another profession here. So just to explain that, radiography is one of the professions, but recently radiography has split into diagnostic radiography and therapeutic radiography. So it's listed as two separate professions on the slide, and we'll tell you more about each one of these professions on the following slides. Next slide, please. So, important bit, how do you become an AHP? So each profession is a degree profession and has its own entry requirements, which the next slide will help with. So the course is either a direct degree, so that's usually a 3-year course at university with clinical placements. So that's being out in a hospital or a community clinic or another setting, working with patients and doing practice time face to face. Or it can be a master's degree, and that would be, this seems like a long way away, that would be if you'd already completed a previous degree in a related subject. So that's a 2-year course at university, again with clinical placements. In terms of universities, so around by us in Lancashire, and thinking about Manchester and maybe going towards Liverpool, universities like UCLan, University of Cumbria, Salford, Edge Hill, Manchester, Bolton, Liverpool, just some of the universities that offer AHP programs, and they all offer slightly different ones, but also you've got all over the country offering AHP programs to choose from. The other way that people can get a route into training to be an AHP is if you have a job where you work in a health or social care setting, and you may then currently you may well apply for an apprenticeship, but that would be with your employer support. So an AHP apprenticeship is a 3-year course with day release to university, and again, placement time in clinical services. Next slide, please. So what qualifications do you need, and what subjects are important for you to focus on if you want to be an AHP? And I'm guessing that's the point that you're at, thinking about what do I need to think about. So maths and English are essential for all AHP professions, and I know because I certainly had a big groan, particularly about maths before I applied. but you'll see on the slide there are wider routes in terms of maths and English and ways of doing that. Okay. You then have to think about completing A levels, T levels, or BTEC in health related subjects. Again, which could be the ones that are listed on the slide, but it could also be things like psychology and lots of other examples. These are just some key ones to tell you about. But as the slide said, it's always what you'd always need to do is make sure that you check with the university around their entry requirement, and also getting work experience or voluntary experience in some sort of healthcare or social care setting is a really valuable thing to do ahead of applying for a course, as it's a great thing to put on your personal statement, and it just really gives you an insight into what you're applying for and whether it's going to be for you or not. So in the next slides, we're going to briefly outline AHP professions, the 14 that we talked about. You'll have the slides to read in more detail after the presentation, so no need to take notes. But before we do, are there any of the professions that we've listed on the slide that you particularly want to focus on? We can go through them all, and we will do that really briefly with you. But if there were any that you wanted us to really focus on, then we would jump to them. So maybe just in the chat, tell us if there are ones to focus on, or if you want us to run through them all for you. We're happy to do it either way. Just give you a minute or so to do that.
We've got someone typing here.
Yes, we've got a few people typing. So yeah, like I said, we've already seen physio, OT, and we've already had a brief session on paramedics as well. So
yeah,
it might be that unless anybody wants further information, we could leave those.
Yeah, absolutely.
But all the others, I don't know if anyone's got any prior knowledge of them or not. Also, somebody's put in ODP.
ODP. So,
yeah.
Orthotist.
Orthotist. Yeah.
What's that? Who's that?
Any others that anybody wants us to? I mean, like Patsy said, we are going to look at them.
Yeah,
most of
we'll
them
go
anyway,
through them quickly.
I think what we could do then, Liz, we probably so osteopath is an interesting one, isn't it, Liz? Actually,
yeah.
Because in terms of our presentation, we haven't got the detail in terms of osteopaths, because osteopaths are not employed in the NHS. So we focused on the ones that are currently employed in the NHS, and that's the one that isn't, and certainly not in our services. But we can, Fatima, we can get you some more information outside of this this call. Okay. And both types of radio. So I wonder, Liz, whether we start and we just skip over, if everybody's happy, we can skip over OT and physio and paramedic a little bit. What you will
go through the others.
Yeah, we have got a video for you, and which is around a stroke pathway, and that will show you a snippet of each of the profession along that patient pathway, which I think will help. Right, and both types of radiography. Okay.
So Brittany, if we're on slide 6, just briefly. So we're not going to go through these particularly in a lot of detail, but they are the art, drama and music therapy professions. And these professions use creative arts to address emotional and psychological issues. And they do work in a variety of settings. And I know that you covered primary care last week. So you would see a music therapist or a drama therapist, not particularly in the NHS, as Patsy says, but you would see them more in primary care, not in the acute settings. Next slide, Brittany. So diagnostic radiographer, a couple of you have actually asked about radiographer. And if you want to go on to the next slide, Brittany, that does give you quite a lot of detail, particularly about diagnostic radiography. Now, most of you will just assume it's the person who takes your X-ray. It absolutely isn't. You'll find a diagnostic radiography producing and processing images of the body, They also do a lot of work producing images. And, you know, if you have an injection into your body and somebody injects a dye, they will be taking all the images from there. So you will find them across the trust, based in radiology departments, but they also work in theatre, they work in cardiac cath labs, breast units, ultrasound units. You will see them in a wide variety of areas. They're not just the person who takes the x-ray when you think you've broken your arm. I think that's what people used to think diagnostic radiographers were. So the couple of people who've asked about radiography, if you'll get the slides, and you'll be able to see the detail when the slides are sent out to you. Next slide, Brittany. Dietitians. Again, you will see dietitian working in the acute sector and also in the community as well. And they assess, diagnose, treat, not just, oh, I need to lose a bit of weight. They often work as integral members of a multidisciplinary team, treating quite complex clinical conditions that would include diabetes, eating disorders, kidney failure, and then you will also see them on the critical care unit for the very acutely unwell patient. Moving on.
I would just add
Sorry.
it as well, Liz.
Yeah.
When we talk about these staff working in, so for dietitians working in all settings, and it says here as well, they will work in mental health settings as well. So they'll work with eating disorders and dementia patients. So there is, again, it's a breadth of scope in terms of where you could work in these professions.
Yeah.
Thanks, Liz.
The next two slides are actually occupational therapy, so if we can move over those and then move on to ODPs. Out of interest, does anybody know what she's actually holding in that picture? It doesn't matter if you don't know, but
I'm not sure that I do, Liz.
Oh right, it's a laryngoscope. They use it. They use it to intubate people. So I think, as Patsy said initially, you won't have seen an ODP probably because, oh, excellent! Someone spent a day with the ODP.
Oh, fabulous! That's really good.
Brilliant. That's exactly what you need if you're thinking of becoming an ODP.
Yeah.
That's the best work experience you can get. So, next slide, please. So the ODPs are, I think, the unknown, unsung practitioners around AHPs, and they are a vital part of the multidisciplinary team. And the role developed significantly during COVID because the ODPs actually went into the critical care unit and worked alongside the anaesthetist, supporting the patients who were ventilated. So a very, very fascinating profession in its own right. And again, I think sometimes they get a bit lost. So if you've spent a day with them, you'll really appreciate just how much work they do. They're not just the person handing over a pair of scissors or a pair of forceps to the surgeons. They are absolutely integral to the work of that, looking after those patients. Did you enjoy your day with the ODP?
Hopefully you did, Ali.
Hope you did. You type it. Yes, it was really good. Excellent. Yes. That's good. I'm glad you agree with me. I love ODPs. They have a great sense of humour as well.
But
worked with a number of them.
As you say, Liz, they're the most most unknown and misunderstood, I think, in terms of AHP professions. People don't really know what they do. Yeah.
Absolutely. The next slide is moving on to orthoptists. Now, I don't think somebody requested orthoptists. You'll have gathered now that most of the AHP titles are tongue twisters anyway. I mean, they get very confusing. But this is the orthoptist. Next slide. And the orthoptists are absolute experts in diagnosing and treating defects in eye movements and problems with how the eyes work together. They are based in hospitals and across community clinics. They do some absolutely fascinating work and do a lot of work with the young in terms of eye screening, but also at the other end of the age group with the elderly, looking at glaucomas and vision screening. So they see right across the age groups, and again in the acute sector and in the community. Okay, next slide. The next slide is an orthotist, and they are practitioners who provide gait analysis. And again, an amazing set of practitioners who again seem to disappear slightly, but they are absolute specialists in looking at a patient who might have a problem like a neurological, a nerve problem, or a muscular problem, usually working in rehab centres, particularly patients who have quite a bend to the spine, the scoliosis, really able to do some bespoke orthotic appliances for the patients. Some really quite complex work that they do.
And that's quite an interesting mix of, if you've got a sort of an engineering bias, but you're also thinking of a health care profession. That's a really nice mix.
Yeah. Yes, some people who do product design then go and become orthotists.
Yeah.
So they use a very different type of degree to then go on and use that in the healthcare setting. So the next slide we'll miss, Brittany, because that's physio. Next 2 slides. Then we move on to podiatry. Can I just say, podiatrists don't just cut toenails. I couldn't
in
be
fact,
a podiatrist anyway.
They don't cut toenails now, Liz.
They don't cut.
That's somebody voluntary sector do that. Yeah.
Absolutely. If you've got elderly relatives and they all need their nails cutting, that's not the podiatry service that will do that. Again, these are professionals in their own right. They assess, they diagnose, really looking at conditions of the foot, the ankle, and the lower limb. So if any of you are absolute sports athletes, they do a lot in terms of giving you what's it called, an insole, but they will design it specifically for you. They again will look at your gait analysis, and they also do a lot of work in terms of the wider support for patients with diabetes. What that person is holding in their hand in that photograph is looking at the blood supply to the nerve. She says, pulling back what podiatrists do. I'm not a podiatrist, I do apologise. But I think that's a Doppler, isn't it?
It is a Doppler. It is absolutely a Doppler. Yes.
You see, it's pulling it back. Are we doing well, Brittany? Because one's a physio, one's an OT. Trying to remember them all. There's a lot here.
You're doing a marvellous job.
Well, moving swiftly on, the next is prosthetists. Again, not dissimilar in some ways, because they again are looking at gait, but they really do work with patients with limb loss. So again, you'll have seen from the Paralympics some of the absolute specialist prosthetics that you can now get. Again, I think that's gone really into with 3D printing. I'd love to be a prosthetist. If I was going through my training again, I think that's what I would go back to. Okay, next slide. Speech and language therapy. Interestingly, nobody's actually said they fancy being a speech and language therapist. They are very popular. Having recently had surgery on my vocal cords, I can tell you just how important they are in terms of advice, support, treatment, advising me on what was the right thing to eat, to drink, how to swallow. I would absolutely say they are quite phenomenal and an unknown, untapped set of skills, really. Again, with similar to other professions, they do work right across children through to the elderly, particularly children with neurodevelopmental issues, and then at the other end of the spectrum, patients who've had strokes or patients with dementia. So again, a small profession, but very important. So moving on. And we come on to therapeutic radiography. And as Patsy said at the beginning, it used to be just radiography, but they have now split into 2. And therapeutic radiography is definitely now a profession in its own right. There isn't actually a training school in Lancashire and South Cumbria. The nearest provider is in Liverpool, but they do have placements in Preston at the Rosemere Centre. So although you might go to Liverpool, you can actually do your placements. That's right, Brittany, isn't it? I think I'm right in saying that.
Yeah, I think you're right with saying that they come back to Preston for their placements. Yeah.
Yeah.
They do. And they've also been highly active in apprenticeships as well, again, so that you don't have to travel to Liverpool. But an amazing profession in its own right. And they have been really doing a lot of work looking at advanced and consultant roles. And they will be very much involved in the patient's journey through radiotherapy, including the total management of that patient.
Yeah.
I hope that was all right, because I know two of you wanted to know about radiography.
Yeah,
The
and
information
I think
is there. Yeah.
Yeah, and I think Liz, you're right. I think diagnostic and therapeutic have really kind of absolutely come into their own profession and developed in their own way. And I think, the advancements in cancer care and the use of radiotherapy has meant the role of a therapeutic radiographer has really developed, hasn't it? And look at hospitals like the Christie, very famous and a very doing some wonderful work in terms of therapeutic radiographers there. So again, and some people would think, oh goodness me, that doesn't sound like a very happy profession to be in. But I have to say, we had a therapeutic radiographer who was at the Christie on a secondment with us, and she absolutely loved it, didn't she? The work that she was doing. Yeah.
Yeah, very much so. Great bunch of people.
Yeah.
Okay.
Great
That
work.
is a whistle stop tour. But again, you will get the slides. We're going to miss that slide out because I know you've had the session. So this video, you could spend hours on all the different clinical conditions that you would see or find an AHP. So this video shows the journey of someone who has had a stroke and the role each physio has. So remember, this is only the things they would do with a stroke patient. We just thought it actually lets you see a real life professional.
Absolutely. And I think it's kind of good to see a patient on a journey and how and why they would come into contact with each AHP profession. I think it kind of maybe helps to make sense of what some of the things that we've just talked about. So hopefully you enjoy it.
Hopefully I've shared it.
And hopefully
sound.
It plays.
So let me know if you can't hear it.
There we go. So if you just want to sit there in the ambulance for me, that's lovely. So we'll just repeat some of the tests that we did inside your house, and then we'll be ready to go to hospital. So we'll redo your blood pressure and your oxygen levels, if that's okay. Here we go. We'll just pop this round your arm, and then you'll feel it going tight. Just keep the arm nice and still. Hold both your hands out again and give me a nice squeeze. Well done. So do you want to just pull that mask down for me and give me a nice big smile so I can have a look at your lips and your mouth again? Your mouth's down ever so slightly on one side. So we'll head off to the hospital now, okay? So we've arrived at the hospital now. I'll help you stand up. Lovely, let's go and pop you into this wheelchair. Well done, nice and steady for me.
Hello there, my name is Nick. We've just been asked to do a CT scan of you. Have you had a CT scan before? Okay. So what we're going to do is we're just going to get you to come and lay down on this bed over here. It's very quick, it takes 5 minutes, it doesn't hurt. I just need you to keep nice and still for me. Okay. Are you okay on your feet, just to get up with a bit of help? That's great, okay. And I just need you to come and lay yourself down over here, okay? So I just need you on your back, on here, with your head just resting in this little pad for me. I just need to check your ID, so I'll just check your band there. Make sure we've got the right name and date of birth. We don't want to scan the wrong person. Alright, so I'm just going to move you into the scanner. Okay, as I said, just need you to keep nice and still. I'm going to put a little strap around your head just to help keep you still. And 5 minutes of a job. Bed just moves in and out, doesn't hurt, just keep still.
Hi, my name's Katie. I'm one of the orthotists here, and we're going to scan your head today for a helmet. Just because of after your surgery, your head's a little less protected now. You're going to need something just to protect your skull. Okay, so if it's all right with you, I'm just going to take a quick scan just using a simple tablet, and then we can show you the picture, and from that we'll send it away to the manufacturers and we'll have you a helmet made up. I'm just going to go all the way around your head, okay? Okay, lovely. And look, that's one head. And it'll just be a hard shell helmet, so as soon as it's back, I'll be back up and we'll fit it on and just make sure that it's comfortable and doing what we want it to. Okay.
Afternoon, my name's Dean. I'm part of the anaesthetic team. I'm an ODP that'll be looking after you during this surgery. So what I'm going to do first is connect you with some monitoring. This is just routine monitoring that everyone gets some data. So I'm just going to pop a blood pressure cuff on, okay? I'll be going up and down throughout the procedure. And then some ECG dots. These just monitor your heart. And then a little peg on your finger. This just monitors your oxygen levels. I'll pop it on the other side because we're going to pop a cannula in this side. So I'm just going to take that hand, give it a wee bit of a squeeze. Then we're just going to pop a little cannula into the back of your hand. So a sharp scratch. There we go. I'm just going to connect some fluid up to there. This just helps keep you nice and hydrated. Replaces your cup of tea you missed out on. The anaesthetist is going to give you some oxygen just as you're going off to sleep. It's quite a nice feeling, but you just picture a lovely thought in your head and we'll look after you. So you just relax your head back, pleasant dreams, and we'll see you when it's all done.
Hi, I'm a speech and language therapist. I've just come to check how your swallowing is at the moment. Is that okay with you? Okay, I've got a range of food and drink for you to try. So we'll just try half a teaspoon of yoghurt to start with. I'm just going to check your muscles now. You just open wide, say ah. I'm just going to pop my fingers under your chin and feel you swallow. Okay, swallow your saliva now. So you're finding it difficult to speak at the moment. Let's see if you can write anything down. So you drink from a cup. Okay, let's see if you can join in on some counting for me. Try 1, 2, and again 1, 2. So if you just have a look in the book, you can point to different things to tell people what you need. So breakfast, lunch, snack, dinner. So your swallowing is difficult for you at the moment. It's likely to improve as time goes on. We'll work on that and we'll come back and see you. But for the time being, you probably need a little bit extra, which might be something like a tube through your nose. And my colleagues, the dietitians, will come and speak to you about that.
Hi there, my name's Megan. I'm one of the dietitians here and I'll be looking after your nasogastric feed while you're here. I know at the moment that it's really difficult for you to swallow and your communication's not great. So I thought I'd just come and introduce myself and let yourself know that you're going to be having a bit of feed going down your tube, and if you've got any sickness or any bloating, any problems with your stools, just let me know and I can come and alter your feed rate or change your feed for you. And hopefully as your swallow gets a bit better, kind of working with speech and language and myself, we can look at some textured diets and make sure that you're getting all the energy that you need and you can still safely swallow. So I just wanted to pop in and say hi, and I'll be back to check on your feed and see how you're doing. We'll get you up to full requirements. Alright, see you later.
Hello, my name's Rachel. I'm one of the podiatrists. I've been asked to check your feet over and see how they're doing. So one of the things I'm going to do is just listen to your pulses and check what the circulation is like in your feet. So Really nice pulse, it's nice and regular, it's got a good beat to it. So the next thing I'm going to do is just check the sensation in your feet, and what that means is I'm just checking if you can feel anything with the with your feet, because sometimes a stroke can damage the nerves. So I've got this little stick here, so it's not sharp, don't worry, I'm not that mean, it's not a needle, and I'm just going to touch your feet in different places, and I just want you to say yes each time you feel it touch. Okay, so if you want to just close your eyes, I'm just going to start with your left foot. Okay, I'm starting now. Just keep saying yes each time you feel it. That's good, you're feeling all of these. So that's that test all finished, that's brilliant. So you had a little bit less feeling, sorry, in this foot, but you had really good feeling in this. But I think your stroke has affected one side of your body, so I'm not surprised that you've got a little bit less feeling in this foot, so that makes sense. So that's me done for today.
Hi, my name's Debbie, I'm an orthoptist. I've been asked to come and test your vision today. So if you could look at the torch for me and follow it with your eyes, not your head. So as soon as you see the red bead appearing from the side, just give me a nod, okay? So looking straight forward at me all the time. As soon as you see the red bead, let me know. Good. And same on the other side. Now as I bring this in towards you, let me know if it goes double at all. Double there. Just keep looking at that for me. What I can do is I can give you a prism that will bring that double vision back together and make your recovery a bit easier. So if I pop this over for you now, it should bring it back together. We'll leave you with that prism for now, because that will help you with your double vision. And what we'll do is we'll make you an appointment in outpatient so that we can review your double to see if it's getting any better, and we can maybe start some exercises at that point as well. Thank you very much.
Hello, nice to see you again. My name's Laura, I'm an occupational therapist, and I'm here to support you and look at your activities of daily living and what's important to you, because the team told us you're ready to be discharged, and this is my colleague. Hi, I'm Abby, I'm the physio that's working here, and I've had a look through your notes and what you've already been doing, and I see you've made some great progress, but I've come today to get you up and have a bit of a walk around and see how you're doing to make sure you're safe to go home. And we're just going to take some nice steps forwards now, just as you've practiced. Good, well done. Okay, now what I want you to do is just lift that right leg a little bit more off the floor to try and clear it. Make sure we're not dragging it too much. Lovely, well done. Okay, now what we will do later is we'll go through some more strengthening exercises for that right leg to try and make sure that you can clear it a little bit better, just so you can walk more safely at home, okay? So we're just going to turn around now and go back to that chair. Something that we're going to do again later in the day is I'll take you up and down the stairs, just again to make sure you're safe doing that as we get ready to discharge you and send you home, okay? So I'm going to let Laura have a little bit of a word with you now. You did so well there, but we're going to have a little bit of a chat about what you need when you go home so you're able to carry on with life as normal. Now, through chatting to the team, I understand you're really into cooking, is that right? When you're cooking for your family, you'll need to use both hands. Well, I've actually got something for you to take home that might help you, and it's a tin opener that you can just pop on a tin and then open it with one hand, so you don't actually need both hands. And the therapy team will come see you once you're discharged so that everything's working for you safely in the kitchen. You're recovering as you need to be. So thank you for working with us today. It's been lovely to meet you and hope you recover well soon.
Hi, how are you doing? We're Bryony and Anna. We're the occupational therapists from the community team. We've just come today to see how you're doing and to bring you an extra bit of an equipment. So this is a perching stool, and this is to help you with fatigue management. It's for use in the kitchen or the bathroom or anywhere else that you might just need to sit and have just a second just to pace yourself. Is that all right? So we'll give it a go whilst we make a cup of tea. Would it be all right if you made us a brew? find the perching stool really helps, because you can just take a seat and have a little perch whilst you're making a cup of tea. It just saves your energy. Have you had a good day?
You're on mute, Les.
Right. Thank you for that. I hope you found that interesting. As I say, it gives you a flavour of the various professions. I think the fact that there are 14 of us, 14 professions, does make it hard to go through it in every possible profession for every clinician. But I think it does give you a flavour. What we do have now, and we've got about 12 minutes left. These are very short 1-minute videos that we have actually created from people within our own system. What I'm thinking is perhaps we could run the ODP one and the diagnostic radiographer one, unless people have got anything else they'd like to see. Would that be okay?
They're literally a minute 20 seconds.
Yeah, that's
quite quick, aren't they? But you'll
Yeah.
have these to look at, and as I say, you know, they're all staff that work in our services.
So perhaps one ODP and one
Which-
radiography.
Yeah, is
Yeah, I
there
don't
one
know.
just any of them?
Any
Not
of
one in
them?
particular that you want me to? Yeah.
Try Sam, shall we?
Oh, who was the?
Don't worry, that doesn't seem to want to play.
Hi, my name's Sam Atkins. I work for East Lancs Trust. I am an operating department practitioner, which means my role is based in theatre. My role now at the minute, I'm a team manager, so I help look after the coordinating of the theatres. In the morning I start and make sure all the lists are starting on time, that we've got no issues with equipment, and just general staffing and skill mix is fine. And then keep on the day-to-day timings and make sure hopefully lists aren't overrunning, or if there's any issues then we'll deal with them. The beauty of the job is I get to meet a lot of patients, can provide lots of reassurance to the patients. For example, I looked after a lady the other day who was coming in for an injection into a hip. So it's just explaining to the patients what the process is, giving them reassurances. I took her into the room, got her positioned that I needed to for the surgery, put on the necessary monitoring just to make sure that she's safe throughout the procedure. And that she's well cared for. And then it's about chatting with the patients, probably because when they're at the most vulnerable and they're scared and they're not quite sure what's happening. So it's just giving that reassurance and care and comfort as part of my role. And then this lady in particular, it was all done the injection and she couldn't really believe it because we'd been chatting, she'd not been really aware of what was going on. So that she was so grateful, and it was that makes you feel really good as a ODP, I think, to look after that patient and know that you've done a good job, you've cared for that patient, and they've gone out happy with what you've done. So I returned her back to the ward and she had a sandwich and a cup of tea and then went on a way, hopefully, of having that good experience that I was able to give her during my role as the ODP.
Okay, think have we got time for one more, Patsy? You're on mute now.
You're on mute.
I guess it just depends if anybody's got questions. I suppose it's time
That's
for,
true. Yeah. Okay.
for that. So
sorry, just to put in, unless anybody wants to start putting questions in the chat box now, and then we can play one whilst they're popping a couple of questions in if anybody does have any.
Yeah.
Does that work?
I wondered about Rita, orthoptist.
Yes, that would be good because she's that's a lovely video, isn't it? Yeah.
I'm sure Reada's actually done sessions as part of this program.
Oh, has she? I'm sure she might have done. Yeah.
Hi, my name is Reda. I'm one of the orthoptists. I'm currently working at Lancashire Teaching Hospital, which is based at Preston and at Chorley. So orthoptists are eye specialists that specialise in how our eyes move and how our eyes work together as a pair as well. So patients that have signs and symptoms of double vision will get filtered through to us. Somebody with a lazy eye, so a turn in the eye, you might have seen children that wear patches. That's one of the treatment plans we give for children with a lazy eye. So when one of the vision isn't developing as well as it should be, we patch the good eye so the other eye gets a chance to reconnect with the brain and build that vision up. Some patients might have a bit of their visual field missing. Those are another type of patients that get filtered through to us. We also see patients with nystagmus, which is a wobble in the eye. So we get referrals from all different professionals, health visitors, school screening. So a team goes out and screens children and they get filtered through to us and we have a closer look at them just to see why their vision's reduced and what we can do about it as well and how we can manage them. Often they just need a pair of glasses or they might need other things. The reason why I love my job is no day is the same. So your eyesight plays a very, very large part in your life and being able to help somebody with that means the absolute world to me.
Thank you. As I say, you'll get the links and you will be able to see the videos.
A female student is being rushed to Queen's Medical Centre after falling unconscious.
Oops, don't know what happened there. So we've got, and can we go back to the, sorry? You know what YouTube is like?
No. Playing a rogue video. At least it was on the right kind of lines for us.
Absolutely. Over to you, Patsy.
Yeah, I'm just. Do you
want me to skip this slide?
No, that's fine. So, I mean, this slide is really just the links, the contact links for you for career leads in organisations that are local to Lancashire and South Cumbria. But obviously, Brittany, as our sort of system kind of leader around this, I think is obviously probably your first port of call or one of your ports of call as alongside these people. So, and you've probably covered that, Brittany, in your other sessions.
Yeah, we'll skip on that bit because they all know about work experience and all other opportunities.
Absolutely. And the next slide again is just more videos in terms of AHP careers for you to look at in terms of what's out there, and also the websites that will be helpful around our professions. So we don't need to go into those now. So then into any questions.
We do have 2 questions. Can you do volunteering as an ODP? My understanding is probably not, because of the nature of the profession, unless you know anything to the contrary, Brittany. But at the moment, I've not seen volunteering happen in a theatre.
I would agree with you, Liz. We definitely don't do work experience to shadow an ODP, just simply because of the nature of the environment that you're going to be in. Unfortunately, the priority cannot be a work experience student in a theatre setting. However, at Lancashire Teaching, so at Royal Preston and Chorley, they do theatre work experience days where it's classroom based. So we get a variety of different professionals from theatres to come and talk and do more of a classroom-based experience for students. Now, we always try and make sure that an ODP is visible as part of that opportunity. So that would be your way for work experience. But like I say, in terms of volunteering, I wouldn't say that you could volunteer as an ODP or with an ODP either.
I think it is just the nature. It's the nature of the environment.
Yeah.
But I think what you can ask for is a visit to talk to an ODP or to spend some time with an ODP talking about their profession. I think that's certainly what you can do. So there are options for that, but yes, I think full-blown work experience is much more tricky.
Yeah.
Okay. Difference between a radiographer and a radiologist. Okay. So a radiologist is a medical doctor. Liz, I'm writing in my
you're right.
summary of this, and my understanding of radiologists is that they specialise in, I guess, diagnosing and treating conditions using kind of medical imaging, don't they?
Yeah. So it's a specialist in its own right. You qualify as a doctor to start with, and then you specialise as a radiologist. A radiographer is a separate profession in its own right.
Yeah.
I can see somebody is still typing.
Yeah. Does anybody have any final questions or queries? Is there any volunteering roles inside the theatre? As far as I'm aware, no. I don't know, Liz or Patsy, if you've got any additional information on that, but not as a volunteer. Mainly volunteers within the health sector support things like guiding people to the right departments. And there's probably lots and lots of more examples that we can use, but we don't necessarily have a volunteer that would be in a theatre. You would need to be professionally registered to be able to be in a theatre. So there's no volunteering.
I think the issues in theatres and the environment, there are very strict health and safety, infection control processes which limit the numbers of people who are actually allowed into that environment, which is unfortunate, but that it does limit that experience. Sorry about that.
Yeah, it does, but there are reasons as to why. And like, I can't remember if it was you, Liz, or Pat that said this, we can organise, for example, if you're interested in particular in an ODP career, then we can organise some, contacts to be shared, or maybe a Teams call or a one-to-one meet or something like that, if possible. I mean, I'm not guaranteeing it, but we can try and negotiate where you can actually talk to an ODP and get some answers to any questions or queries that you've got directly from them.
Thanks, Brittany.
Okay, does anyone have any final questions or queries for us? We are to time. I think you've just got one more, so you've just got one more slide.
Yeah, that's just a thank you, and that's our contact email. If you come away and you have some questions for us that you didn't ask or you didn't want to ask on the chat, but you do want to ask us, then please take this down, and we're really happy to give you any answers that we can.
That's brilliant. Thank you so much. I will just give everybody a second to potentially write that down, or if you're able to just quickly pop it in the chat box so I can stop sharing my screen, just so I can sort of see you all then. Okay, so thank you so much. That was really, really brilliant. And that video is incredible. What a good idea to have a patient journey so you can see 10 of the 14 or 15 AHPs. So, even I found that really, really interesting and really sort of insightful as well. You're getting lots and lots of thank yous in the chat box. We really do appreciate both of you giving up your time to come and speak to the students as part of this programme. As Patsy said, if anyone's got any final questions or queries, please feel free to drop them an email, or if you find it easier to email me, then please do, and I can make sure it's forwarded on
absolutely.
an answer for you. All right. Okay, that
Yeah.
is great. So just before we finish, just want to confirm we have got a session tomorrow. So tomorrow's session is the introduction to apprenticeships. That is 11 till 12, and that is with my wonderful colleague Hayley from Morecambe Bay NHS Trust. So I will see everybody, all the students tomorrow, and I hope you really enjoyed this session. All right, take care,
Thank you.
everyone.
Thanks for having us.
Thank
See you
you.
soon. Bye. Bye. Thank you.
Bye. Bye.